Hey guys, welcome back to my channel. My name is Addie, DJ Adija, but welcome back to Addie's Corner. Today I'm going to be talking a little bit about myself, my journey, what I'm doing currently, and the genesis of all of this. So, what am I doing right now? I'm a psych nurse practitioner. I focus, of course, on mental health, diagnostic, prescribing, and I also deal with actual drug addiction and prescribing and caring for those patients also, in addition to the general depressive, anxiety, schizophrenia, bipolar patients. And we see that there's an interlap in some of these diagnoses. Before I got here, I do want to talk about my journey as a nursing student. Well, before I even got to nursing, I was initially a community health behavioral degree individual. However, life didn't happen the way I anticipated it, so I changed gear, and I've said many times on this channel, restart is never from ground zero. One thing you guys will also learn about me, and one of my phrases is life is not linear. So when we talk about restarting, I decided to go to nursing school, and of course I knew I've always wanted to be in the medical field, but which direction I wasn't sure. So I did everything on my science prerequisites and things of that nature, which we will discuss on this channel for those people that are interested in nursing school. What do you need to do for prerequisite before getting into nursing school? How will nursing school look like, and what do you do post nursing school? Those are things I will talk about on this channel. But during that time, I did work at Patient First while applying for nursing school and waiting to hear back and things of that nature. So I went to Salisbury University for my nursing program, which was a 12-month program. Was it hard? Yes. Was it doable? Yes. Is it something anybody else can do? Yes. You just have to be determined, and I do encourage you guys, for those who are interested, to look into the school. I felt very prepared when it came to taking the NCLEX. Moving forward, I started working at George Washington University Hospital as my first job. Was a great learning experience. While working, I decided to go back to school for my nurse practitioner, and deciding which, because of there's so many, well, not so many, but the variety in regards to specialization, I chose psych. I've always been interested in mental health. And I chose psych because of that, and also the flexibility. Again, life is not linear. I've done med surg, I've done oncology. Even right before that, I'm still doing oncology, the chemos and all of that stuff, and you see mental health in all areas, whether it's in med surg, whether it's in oncology. You see mental health in all areas. You see it everywhere. Even when you interact with people you're around your day to day, you see it. And that's one of the things I do enjoy, in being able to cater to this population, because we really do focus on physical health. But if you're not holistic, it's very hard, But to be able to care for somebody to live their optimal health, regardless of where it is, I think it brings me joy. I'm going to touch on those little things, but I did do all of those things. I also did psych. As a psych nurse, I was also a psych nurse. So do not limit yourself. That also, just telling you guys the little things that I've done within this span of 4 years is to tell you that there are options in nursing. So you don't have to feel like you're boxed in. You don't have to feel like you only have to do one aspect. There's so many ways. There's so many things. So I'm not saying be a nurse, but I am encouraging those people that are thinking about it, that there are options. You don't have to feel like this is the only thing you need to do. So as a psych nurse practitioner, I will be touching also on just educational, okay? So for students that are aspiring to be that, so for NP students, they can benefit. But for also people or patients, they can benefit from this channel. Why? I will be talking about some of the common medications that we use in treatment. So for those that also want to just increase their knowledge because their friend or their family member is receiving mental health services, I think this will be the channel to benefit everybody. I'll be touching on medication. I'll be touching on non-pharmacological ways to deal with mental health also. And we'll just increase our knowledge on this channel. And yeah, that's it. that's my journey, and I do wish you guys the best on the journey. Of course, if you have any questions, put in the comments. I will be responding to comments. Do not forget to share. Do not forget to like. Do not forget to subscribe to this channel. Thank you and have a good one. Bye-bye.